my 3-month-old child is continuously crying for the last 2 hours. Is it something serious? Frantic call comes to the doctor. What are the reasons for this? Let us see in today's video. Hi friends, I am Dr. Karamat, pediatrician, and this channel is Scientific Doctor. I thank everyone who have subscribed to this channel. For others, this channel will release every Wednesday a new video on medical science related topics, mythbusters, childcare related topics. If you want to see such videos, consider subscribing. Also press the bell icon for instant notifications on new content. Friends, let's see today what is colic. Probably every parent understands this. Suddenly a young infant starts crying who is not consoled by anything, even the mother feeding. So what is happening to this child? Every parent would have gone through this scenario. So what is colic? The age-old definition of colic: a child cries more than 3 hours a day for more than 3 days a week for more than 3 weeks duration. But your doctor on examination may diagnose this condition with even lesser crying. But how colic is different from normal crying? We must understand colic is a crying in an otherwise healthy normal child who has apparently for no reason starts to cry in a particular time of the day and is not consoled by any means for a certain duration. That means if the child in between crying is not normal, then it is not colic, then it is something sinister. You need to visit the doctor immediately. Colic usually starts by 1 month of age, peaks at around 6 weeks and disappears by 3 to 6 months of age. What are the causes? Traditionally, colic is thought to be due to some intestinal problem. Grandparents may say the abdomen might be distended and you may pass some gas, there is flatulence, so it is due to some abdominal discomfort. But in colic, because of the excessive crying, there is excessive intake of air called aerophagia. Because of this, there is abdominal distension, and due to that there is flatulence or passage of gas. So this abdominal distension and flatulence may not be the cause for colic but may be a result of it. But there are other factors which might be involved in the causation of colic. Alteration in the intestinal bacteria. We must understand there are millions of good bacteria throughout our intestine which are helpful to us in many actions. When the proportion of this bacteria gets altered, you may get colic. This is proved by the fact that when this bacteria are replaced externally via drugs called probiotics, it has some improvement in the colic. Breastfeeding is the best feeding for all children, especially for newborn babies. Anything apart from breastfeeding should not be given. But for some reasons, if cow's milk is started, this can give rise to intolerance and it may be a cause for colic or crying in infants. Often, poor feeding technique or lack of burping is said to be a cause for colic, though not conclusively proven. We have seen the causes of colic, but when should you worry whether it is colic or something more serious? These are called red flag signs. If these are present, you should rush to a doctor immediately. Vomiting, especially if severe, fever. A child with colic should not have fever. If the child has fever, it could be due to more serious causes. So the crying has to be evaluated. If the child is irritable, as I already said, in between the crying episodes, a colic child is totally normal. If the child is continues to be irritable or lethargic in between the crying episodes, then it is not simple colic. As I said, most of the colic infants have normal weight gain. So if there is poor weight gain and excessive crying, again you must visit the doctor immediately. If these red flag signs are not there, what can be done at home to prevent or treat colic? Poor feeding techniques can often result in colic, so the child should be fed in a proper position. Most often it is better to give feeding in the sitting position, and the baby's head should be at a higher level than the body, and the baby should be closely held by the mother while feeding, and after feeding the child should be burped before put to bed. These are the methods which can prevent colic. If the child is crying, what can be done? Simple gentle rocking motion of the child can sometimes stop the crying. What I have witnessed is often the babies are shaken vigorously. This doesn't give any comfort to the child, can be indeed harmful. So the rocking should be gentle at a frequency of 1 movement per second. Often it is noted the child who goes out in the car or in the bike to the doctor, in the way itself the child stops crying. So probably an exposure to a different environment may help. If these measures don't yield any fruit or the child has any of the danger signs as mentioned before, you should visit the doctor immediately. What is the role of a doctor? The role of a doctor here is to rule out serious causes of crying in a baby, which can range from a simple ear block or a colic to a meningitis or a brain infection. After ruling out the serious things, the first medicine the doctor gives is reassurance. Knowing that the child is not going to land up in any serious disease itself is the biggest relief for the parents. Additionally, there are 1 or 2 medicines which can be of help in the treatment of colic, which may be prescribed, but those should be taken only with the prescription of the doctor. Will colic cause any harm in the long term? Many studies have proved colic doesn't have a long-term effect on the health or the behavior of the child, so you need not worry about these persistent crying episodes. Can we give these remedies like gripe water to these colicky children? Gripe water, when it was originally manufactured way back, contained harmful substances like alcohol. Even though many of the harmful substances now have been removed, studies have adequately proven that it doesn't give any benefit, and the ingredients and the method by which these are given can indeed cause harm to the child. So these are better avoided. Friends, this was a short video on colic or excessive crying in infants. If you like this video, kindly share with your friends and relatives who may also be benefited. To view such videos, consider subscribing to this channel. Thanks for watching. Till the next Wednesday, bye.